Good afternoon, folks. We're a little tiny bit late, but all good. Wanna.
Sure. Senator Solomon? Here. Senator Canope? Chair Sanchez? Representative Reschke? Okay. Chief Barrett?
Present.
Vaughn Berry?
Present.
Rob Corbett? It's on yet. Annalise Dolph?
Here.
Jamie Floyd?
Present.
Dr. Tom Jean? Todd Jeter?
Present.
John Colmer?
Here.
Sarah Lochner?
Present by video.
Jana McCamey? Director Prince? Marcus Reed won't be here. Jason Renault won't be here. Janelle Romaine? Valera Salazar?
Here.
Aaron Sarnoff Wood? Quorum is present.
Going down to it. We're not gonna review work done right this very minute, but we are on schedule to do that today at some point because we will be, of course, getting to our last, we're down to our last, couple of meetings here. We'll need to go through the work plan and make sure that we've touched on the many things that we've discussed throughout this time and ensure that we've fulfilled our commitment to doing all of those pieces. The question, your responses?
No, right now.
Not right now. We'll also, of course, folks who have submitted your recommendations and stuff, I appreciate that. If you have not, please make sure we get those in as soon as possible. We will need to be reviewing those. We'll talk about doing those. We get to them, but we really need to make sure that we get those things there as soon as possible. And then, determine the format of how the task force will make those recommendations. So,
Sure. July 25th deadline for that, so.
yes.
Okay.
July 25th deadline for that. We are also still holding July 26th if you feel like we need more time to have more conversation. Everything in the world, but okay, we're gonna do it. I have to. Okay. So I would actually just like us to launch right into the legislative revenue office's analysis of the fiscal impacts with 3610.
Well, thank you for saying this here and trying to get my on shared with you as possible.
There we go.
One. So, just with introduction, I'm going to almost say for the record, my name is Matt Smith, the Legislative Revenue Office. And thank you for having me the House Bill 3610 as the Legislative Revenue Office to help on this committee. And which is basically ideas and more consultation on how to do things and what does it mean. And I've been with your meetings online most of the time. So, and I was like, you know, give and take and so on. Excuse me, so sorry.
You get up just a little bit.
We have a-
Hard for.
we have a mic here.
Yeah, that'll be very bad because folks online seem to have a harder time hearing us sometimes.
Okay,
Is that better, everyone?
Is that coming through? I hope.
We have some positive. notes.
All right, thanks so much. All right, again, Mazen Malik, sometimes people have difficulty with my first name. Let's say Malik, translates, last name translates into English as king. So you could address me as your majesty. Anything of that sort. I do work for the Legislative Revenue Office, which is a nonpartisan office. We, I work with, both chambers and minority majority. We get applies to everyone issues of tax policy and revenue policy and so on. And we basically a group of economists, about 6 of us. And I put in your packet a couple pieces of information. One of them is the alcohol revenue, fees and tables. This comes from our basic facts publication that we do an update every year. The basic facts publication gives kind of an overview of what things are on different issues. And also I've heard there were a lot of discussions and questions during some of the deliberations of this task force about the small wineries and where the small wine implications and so on. So I called for you what known as the the small winery tax expenditure. And this comes from the tax expenditure report done by the Department of Revenue, and they have an estimate of what these costs are, and that might be things that you will find useful on the discussions that we've done before. So quickly, as I said, we're all economists in the Legislative Revenue Office, and if in different disciplines in life you will have different kind of logos, you would have the physicist, let's say, with the atom going around, and the medical doing curves and so on, and lawyers with justice. So economists would have this kind of logo, which would have the supply and demand. We understand everything, kind of supply and demand. So this is who we are. But quickly to go quickly on what supply and demand and how it's different. Supply and demand always comes with what we call as a necessity of demand. Necessity of demand for price means what's the response of the demand when you change price, right? And just to hit you through these very quickly, the green line here, you would find this guy. This is what we call unit elastic. And the unit elastic is a very interesting case because every 1% change in price gives you 1% change in demand. That's what the unit elastic is. And from that point, you have few other calculations. You have the very elastic, meaning if you have 1% increase in price, you would have a lot more percentage increases. And this is going back to 202 economics course. The important thing here that you would have is the very inelastic, which is the yellow line, and then the perfectly elastic, which means you always have that demand, and perfectly inelastic. Perfectly inelastic means you will buy at any price. So quickly, why do I talk to you about these things? Here's what an elastic demand means. When you change price, you get a large impact in quantities. So here you have 20% change in price going from $50 to $60 when the price, whatever the units are, and then you get 50% decrease in demand. That is a very elastic demand point. And elastic demand, which price elasticity demand is what we for short. When it's less than 1, you have a very inelastic, which means changes in price lead to smaller percentage change in demand. In this case, you would have 40% increase in price, but only 10% So in these cases, price is not as effective to curb demand. So it becomes, price is not, a policy tool besides only, price and tax policy. Perfectly inelastic demand, which is means there's no choice. So some people would call it like gun to your head demand curve. If you having a heart attack, what's your demand curve? You'll pay any price, right? So it's zero elasticity at any price you will buy. Some would say that under these conditions, the suppliers will whichever they increase and the supply will decrease it, people will still demand it. And in cases like this, the particular thing about it is here is the classic, most essential time where government controls, government's regulation becomes the paramount in any market like that. So some people would also say that, addiction is perfectly elastic, but we'll have to leave it at that. So what is knowledge of elasticity tells us? So if demand is inelastic, then increasing the price can lead to increase in revenue. So that's why you would have monopolies, right? That's where monopolies come in. And regulation, this is like OPEC monopoly, they have all monopolies to change the product, demand basically on price and then compete control. So the demand is elastic. So the firm will likely increase revenue as they could and by doing advertising, brand loyalty, more things like that in order to outwork. And then you have the price discrimination. So just to put it all in a nutshell, here's the elastic demand, the first one inelastic, you will see the price and quantity of action that, and the perfectly inelastic demand. Now, why I'm telling you all of this, I've worked for the legislature for about 23 years. And for a long time, I did what so-called sin tax. So what a sin tax is, smoking, drinking, gambling, recreational drugs, cannabis, and so on. So most of these, what sin taxes have in common is that very index, which means that there are a lot more, some more than others. Increasing the price doesn't really affect behavior so much. And that's what you've been having a lot of the discussions about. So the economic study that you have some going and back and forth about, that's what the economic study basically said. If you use price only as a policy tool, you're not going to curb use significantly. And that is also true in a lot of other studies. So that basically what it comes from. So in places like this, you don't have, if policy tools, the regulations becomes more effective. So, for example, when we did smoking, a lot of people would think the higher taxes that we put on cigarettes and tobacco reduced smoking, and now it's raining out. And that's true. But remember, without the Clean Indoor Act, without the other regulations, no smoke in the work, no smoker 10 feet away, and so on. Without those, that actual the health awareness campaigns, teen prevention, that is what made the difference in smoking, not necessarily only drugs.
Just a quick comment, Tom Gino, HA, is that the opinion of your office or your personal opinion?
That's probably this, not only my personal opinion, I think it's more prevalent opinion within economists, not necessarily house advocates. So if you're looking at that, that's where it came from. All the studies, no studies have only isolated it to only price increases that made a difference. Actually, the discussion always has been, who are you taxing? Because smokers seem to have been majority, a lot more lower income and so on. So that's the aggressivity that we're discussing of the tax incidence of West smoking, taxing, tobacco. So, I mean, discussions could be either or, but, that's basically what it comes down to. So, inelastic demand in this sense, what is special about it is you could actually have lower supply. And here, put this number 2, you would have supply at 80, but you have a higher price, and you would actually end up with higher revenue and lower supply than higher supply and lower price. And you have the price necessary. So, as we were talking about alcohol, we surveyed literature overwhelmingly. I think very few people would, in the sense of any literature that you find, would actually argue that that beer, wine, and distilled spirits have those elasticities. So it's somewhere the literature finds it to be between 0.3 and 0.4. That's very inelastic. And wine elasticity seems to be higher, and so is distilled spirits. It's a higher elasticity. And alcohol overall variation in substitutes is about 0.77. It's still elastic, however, these are the most inelastic. But inelastic demand means the consumer also bears most of the tax burden. However, increasing prices are not likely to use of beneficence. So that's because of the ABC and the rise in quantity.
Can you say a little bit more about that? The inelastic demand means the consumer bears more of the tax burden. Doesn't that depend on like each state's tax? Of the tax structure?
Well, that could be, but let me, since you asked, I just included this thing for you. So this is what it means in economic terms or in graphs. When you have elastic demand, meaning it's more responsive, the more you increase the tax, so the tax goes to 14, you have what we call as producer burden versus consumer burden. And if you see the graph on the left, you would see that on inelastic demand, you get more of the consumer burden than the producer burden because the way inelastic demand is working. So that was a great question. You have the answer. So, since we're done with the course of 202 and you have that,
We get our certificate.
you get the test at the end of this. So you have just quickly see about also in addition to the privilege tax versus what upon the sale tax or the beginner tax. How these work. Today you have a privilege tax. It's levied on either production or distribution cycle. It's folded into the price and the markup process, or the lower the point of taxation, the more it carries its price. However, it is very efficient in collection because you have a limited number of distributors that will pay. So you're not collecting from tabs, just have at the max, you would have a couple hundred, not back that you're collected. So in that, there is an efficiency in collection. And one of the existing mechanism is basically done through the regulating agencies, through the OLCC. And one of the downsides to it, of course, it's never just jurisdiction without action, legislative action. So a point of sale tax, and why we're talking about point of sale tax, because this has been the way that we've looked at new taxes or new way of taxation in the same tax area. Particularly, it came very strongly through the time when we did the legalization of cannabis. Cannabis is taxed at the point of sale, and it's resolved a lot of problems. So the problems with distinguishing between different types of brands of, does this have THC of 0.76 or that? So you don't have that issue anymore. It's all carries in the process. It builds up to the end price and then to the consumer, and that's what you tax.
Jan Katie with the Oregon Wine Growers Association. I just wanted to point out, that producers are in a global marketplace for wine, and so the ability to raise prices isn't inherently there. They'd have to price things what the market will support.
That's correct. That is,
That's the producer side of the tax. So if it's, consumer tax, that may be
And-
different, but for producers, they can't just simply raise their prices without seeing effects on demand for their products.
and then, the second chapter of the 202 public finance would say there's also a price elasticity of supply. And we would have to go through that price elasticity of supply. But that is true in market competition, meaning you're looking for market niche, slice of the market, how much do I compete? And that competition between producers is has a different set of equations and changes the slopes of the curve into a different levels.
And just to also point out that Oregon wine has the highest price wine already in the US.
I'm not gonna argue.
We can get into farming practices and labor practices and all that underlie it. It's not simply a profit, right?
And we'll get into some of that. So the thing with the point of sale is that has less price escalation. So if you put it in the producer, you don't have the markup process carrying and multiplying the price of the tax into the price. And it becomes a distortion in the market distribution. One of the downsides, of course, of point of sale that you have to collect from thousands of really that's and a new process like that is probably not going to be somebody like the OCP that unlikely a thing or the Department of Revenue. These people are the people who know how to collect taxes and put things down. So the same thing they are elected. So it also can be percent of the price, which accounts for inflations and other type of things that like the French. So there's also a third type that people usually talk about, which is the per unit tax. They talk about the 10 cents per bottle and so on as a model of taxation and so on. And although it could be done on ounce or ABV, etc., it's really very inefficient because you have to distinguish and discriminate between all different types. How much is that? And then you would have all the machinations of knowing how much in which bottle and that kind of stuff. It doesn't really work as cleanly or efficiently. So you would have the efficient tax is that you spend the least amount of money collecting bargains. This would probably have a lot more actually cost and moving costs to the retailers. So since we've talked about this on a sale tax or what we call the post, one few things I have to put in front of you with that is price elasticity can generate revenue without disturbing the market too much because of inelasticity of demand. So it can go up to something like 6-8%, not creating winners and losers in the marketplace and the competition is doing this. So, one way that you can also lessen the impacts on the markets, for example, going on value with 2% increase, let's say every 2 years or 6 years, let's say 2% of biennium or 3 biennium or 5. And that takes also the bite of increasing on one time or that changes behavior of the fund. It just maintains one mechanism of finance. So each, in addition to that, increases could be conditional of set criteria. These have been done, for example, as we've done with the transportation taxes at some point. We have 2 cents and so on. And each increase based on set of criteria. However, you also need to allow for collection costs for retail. People are collecting and transmitting the money and so on. So there needs to be some level of collection costs. That hasn't happened. And also administrative costs for the election agency, such as on the revenue. So, however, you could dedicate these revenues to specific programs, set up time, or allow for establishment time for programs, monitor, audit, report, and so on. Coordination mechanism of the audits and basically does that, check off on the okay on these type of conditions that we put at testing. That one, everybody buys on that, right? So since we do that, let's give you some estimates and impacts if we do this. When we look at the beer market, United States beer market is about $114 trillion. And that's about 44% of the total beer market. Small independent craft in the United States about 13%. However, it's about 15% in Oregon. It seems to be a higher percentage in Oregon than in other places. Oregon market is about estimated 1.3 to 1.4 billion. The field tax, the privilege tax, if you translate that, the 85 million to percentage tax, that would come to about 0.6% of tax rate. That's the current. That's the current. Okay. But not as privilege tax, but dollars of total value. So let's see. The wine market in the United States, and this is again about the wine market is a lot smaller. 16% of the total overall market. The Oregon market is estimated about 500 million change. And if you, excuse me, if you do the same translation of what the taxes collected today under the privilege tax, also about 8.5 million, it implies about the current tax rate in wine is to be 1.64%. So obviously the line is taxed at the higher rate every year. And if you consider a post or on a same tax, 1%, 2%, 5, 6, and 7, and when you start going to the 5, 6, and 7, you start looking at more of the elasticity working into the revenue. However, as we've been trying to convince you all this time that the demand is inelastic, so elasticity is not that much, but it does work. It's solid here. Basically, each 1% approximately brings you about $19 million. 14 from beer, about 5 from wine. And that's the information as you go along.
Quick question, Gino and Jay. So is that just chance that both beer and wine are bringing in $8.5 million of tax each, despite different tax rates?
That's right. It's just chance, really.
Yeah.
Yes.
And it's been very steady almost. I mean, it goes up and down sometimes, but for, no, for whoever, I wasn't around when the tax was designed. That's one of the few taxes that I wasn't around. But
Says it up.
somehow that, kind of worked that way. So, an impact scenario that I wanna leave you with to ponder, and I don't know, but this would be what a skeleton that you might want to consider moving features. But if a 2% increase every 3 years, that gives you about $38 million. Increase 3-4 times, 6 or 8 years, depends on what your funding and why you fund this. Remember, tax policy and tax, revenue policy is for funding, not for, obviously, even under this kind of market demand of elasticity. You can't really use it for too much other stuff. So smaller impacts to the market, producers and suppliers. And with a 2% market can absorb the increase without much disruption. Think about growth. Excuse me, I didn't hear.
I'm not gonna say that. I got it, everybody.
Well, it's the last tax.
Not so preference.
So that increase, if you think about market growth and market changes and what inflation and so on, 2% will have very little disruption on the market. But also consider that we would have connection costs for retailers and admin costs for Department of Revenue. But don't tell Department of Revenue I said that. I didn't consult with them about the 2-3%. That's what has been great.
Aaron Sarnoff with 2000. One question, is this concept in lieu of the privilege tax? Or is this in addition to the privilege tax that they're already in?
I have not put any change or new mechanism. We could definitely look into that, but this is just basically a skeleton. It's not necessarily a proposal that we're putting in front of, but this would be a skeleton that stands in the that would be a negotiation thing.
Can I just note again, Eric, we did not have that conversation about an in lieu of at all. Given that the existing taxes that was occurred throughout this time, the county, Central County is already using those funds in their specific manners. I think in the first, I would suggest that we change that whole model at this point.
Just asking.
Yeah.
And,
I think it would be a comment.
are you familiar with the concept of substitution? As it refers to elastic demand?
Absolutely.
So in his situation, we're seeing increasing cost on beer and wine, but of course, spirits in this particular situation. We saw a similar the situation in Illinois when they raised a spirit and wine tax, but not on beer. And they saw that the overall reduction in consumption was muted substantially because they saw a shift of consumption to the less taxed products. And in addition, even within categories, they saw people, if you were a top shelf shopper, you were now a middle shelf shopper, and you kept buying the same volume, just at a lower cost per brand. But of course, in Oregon, the majority of Oregon producers are craft producers on the high end of the cost spectrum. And the low cost options are international or national conglomerates. That's, they have economies of scale to produce much cheaper than we do. So, i.e. moving consumption away from Oregon production and basically in favor of larger national producers.
Yes, I mean, substitution effect in the alcohol stays within the alcohol. Let's agree that stays in the alcohol market. What you're talking about is segmentation of the market. segmentation of the market is real and it happens that way. And what you described is quite accurate. If prices go up too much, it depends, and here also the design of the tax makes a difference. You bring everybody up in the same level, or you take percentage of everybody into a certain percent. For example, if you put, let's say, per unit tax, and you say each, or, and this is an example, not to pick on anybody, but let's say a beer that costs $6, and one that would cost $2, you say per unit, taxing them 50 cents. What you have done is basically made the higher price more attractive, right? Because so it depends how you do, or what tax you have looking at in Michigan or Illinois or something. Not all taxes work the same way. Some work in less disruptive manner. You want to actually have the tax equity, which means you don't want to create winners and losers in the market. And that's where the lower bites of the tax and how, when it comes, and more gradual and less intrusive into the market, the tax is more efficient, the tax. Equitable, not in the sense of equity in the social arena, but in the economics, in the sense of,
Jamie Clay with Ninkasi Brewing. In this analysis, my understanding is that total burden to brewery to alcohol producers in Oregon, it's a tax burden is higher than it is in other states for especially alcohol producing. Right, so it's 45%, national average 49% for alcohol producers in Oregon. Any of that analysis try to show what that would raise that through for the 2, 4, 6, 8 years in the future? We haven't really talked about that because just being in business is more expensive here. And then we pay an excise tax already. We pay a cap tax, similar to Aaron's apples. My hops go through 5 cap taxes along the way before the customer gets it. I'm just kind of setting a tone of that word equity. It gets a little ominous if we're going to have a tax.
No, I understand exactly what you're saying. Just to answer this, what we are looking at, the analysis is assume something that economists love to say, everything else staying the same. Right. So they're not changing the assumptions of the rest of the assumptions of the market. But the market as is when we have in that sense. If you are looking at different impacts on how the supply or the production costs, and that's a production function in terms of why it is more expensive in Oregon than not. That's a different set of analysis and different set of discussion that it's not necessarily the tax discussion per se, but it becomes in the other face of the coin about reducing drinking by increasing price. So there are things that tax policy is not going to solve. Tax policy has certain amounts of objectives to reach. Those objectives will not. So again, just to finish this off, you could choose to dedicate this revenue to a particular program or accounts. That means it does not have to go through the OCC distribution process, because this could be dedicated tax.
Sorry, to that point, and to what Sharon's son just said, so you could have essentially the same formula that you have now with the excise tax with the new sales tax.
You could.
Yeah.
But you don't have to, because it's a different stream, different, you could have a stronger nexus, you have a different priorities, it does not have to be the same, because it's coming from a different tax and different induction mechanism and so on. So you have the freedom You either choose this or choose that. And, so if you want to set programs in that sense, when programs you set, you have costs, the startup costs that you absolutely put in the process review. That is the essence or the elements of really good tax policies and you have the views of audits or some reports and paying the tax of the nexus of the tax of what the program is really actually achieving this. So you would have the taxpayers having a lot more comfort that the taxing the money is funding what they agency certifies. However, you could look into a tax exemption or tax breaks to incentivize small business. For an example, the same thing that you would have in a tax expenditure for the small wineries, you could have, let's say, for the craft breweries, one of their establishments or their main establishment that are exempt from paying that. That only one or the name or something. So that could be some tax expenditure.
As to now, roaming with that right here, my distributors. The reason the wine exemption is written the way it is to incorporate in-state and out-of-state wineries so that you don't run into a constitutional problem. So you couldn't just say Oregon gets this, but not. So there's reason why. So I just say there is a way to do that with an exemption, but it does have to apply for in-state and out-of-state.
Absolutely.
Yeah.
That the government counts clause is very prominent in tax design. And that could very well be any tax, any production craft brewery, the main production line could be exempt, and that whether it's disabled, that's
Up to a certain number of.
that could be drafted in that sense, easily getting the smallest of the small that means economic development. That type of that is doable. It's been done. Besides the reform, it's not something else. And I think that's all the formal thing I have for you. And I hope it was useful to you.
Thank you. Okay, folks, you take this. Sure.
Often denounce again, with their money distributors, the collection fee, I thought was interesting, because we don't have a collection fee for collecting the excise tax now, and I'm curious. How common is that with taxes, that there's a collection fee on the entity that's being taxed? Or a collection, not a reimbursement, whatever it's called, yeah, like
It's from the
that they're paid essentially to collect the tax. That's the benefit.
It's a feature that Oregon tax collection considered for many of the taxes that we do. They do that with cannabis collection, even fuel tax collectors. I think even some tobacco. So that is, it's been done at different times, different, it depends on the cost of action.
Thanks.
Other questions? Folks online have any questions?
Aaron Sarnoff with Two Towns. So again, looking at your analysis, these are mostly financially driven taxes. You're not seeing much of a public health benefit, given the elasticity or inelasticity of the product. So this is primarily to raise capital, that intent behind the model that you're looking at.
But yeah, in the short answer is yes, the public health in the sense as I think you discussed it to, very exhaustively, that tax policy is probably not the best tool to use or to use. It must be, you get some, but if that's what you're using the wrong tool. You're using a hammer to fish. It's just not, as it were. Yeah. That's, how many fish did you get? Got one.
Okay, online, starting with Rob.
Yeah, thank you. My question for Mr. Malik was in your presentation, you used as an example that if we needed to raise $8.5 million off of the craft beer industry, $8.5 million off of the wine industry, where did that $8.5 million number come from?
Rather, that number represents the current collection of taxes that we see coming from these two industries from what we know as the privilege tax. So this is the current collection amount that we have today. Yeah, plus or minus around, but in general, they about come to 8.5 million apiece. And they, by coincidence, happen to be the same number coming from the two universities.
And it's an annual figure, correct?
That is correct.
So it's an annual figure. I think Rob, what he was doing was trying to sort of calculate that into a percentage as we were talking about percentages so that you visually see what the percentage was. That is what the current rate is at this point in time. So really 17 million. Yeah,
That's what we get.
annually. Okay. Todd.
And your, I think the assessment, that the taxes would not be a deterrent to consumption. What you're assessing is the direct impact of someone paying more impacting their use. Am I correct? You haven't done any assessment as far as what would the deterrence of use be through this tax if said dollars that were raised were, for example, invested in prevention, and how that might impact youth.
Sorry, there was some distortion.
Yeah, I'm sorry. I didn't quite get that either. Todd, can you repeat that, please? And if you're talking, you're on mute.
Sorry about that. Can you hear me now?
Yes. And you're on mute again. There you go.
I said that, is my understanding correct that the analysis that you did that led you to believe that tax increase would not deter youth related to
I'm sorry, Todd.
the increase in cost? Is that correct?
You're still cutting in and out. You're still cutting in and out.
Okay.
Can you maybe type that into the chat so we can read it and answer that question? 'Cause we
Invested in
can't-
prevention.
I think so this is Annalise Delph, the Alcohol and Drug Policy Commission. Todd, if you can put it in the chat, but I think what Todd's trying to say is you're just looking at the price effect on use, not where new revenue were generated in prevention. Would that bring value to use? I think is what Todd is trying to say.
Yeah, I think it's that, yeah, that's a quick, no, there is no dynamic analysis in place. We get this money and we apply it here, what would it do? That's a different set of problems that we are not necessarily looking at. Is the idea, is there going to be a reduction, some reduction? Perhaps, I don't, with small increases, I doubt it, but if there is, it's icing on the cake, I don't know, it's probably, but I don't. The change and remember the perfectly inelastic, there are people that are going to think they cover what we do. Any price that is just way why city taxes kind of have these government over regulation and oversight on them. You know, whether it's the federal government, the ATF or the OCC or so on, there are certain things that actually have to have government intervention in that market, and alcohol is one of them. Because of this.
Yes, Sarah.
Hi, everyone. Sarah Lochner, Coalition of Local Health Officials. I think both Annalise and Todd kind of already covered what I was going to say, but I just wanted to point out that while raising taxes may not hugely decrease consumption, what they are good for is raising money for quality programs that will then prevent youth from using. So if we use the additional tax dollars to invest in prevention, that's a public health measure that will do good over time. So just wanted to throw that out there.
Thank you. Any other questions? Yes, sir.
I'm Gino HA. Thanks again for your presentation. I just wanted to point out for the task force that, you know, none of the price demand curves that we showed for beer, wine, spirits, none of them was close to perfectly inelastic. There was definitely significant elasticity, even if it's only a 0.3 coefficient. So that means when you raise the tax, you are reducing purchases and use. The other thing I would point out is that most of the people who buy alcohol are not addicted. They don't have alcohol use disorder. So they're going to be more sensitive. And even though they're not addicted, many of them are drinking excessively. So either binge drinking or heavy drinking below, you know, an actual addiction. And that's part of what we're trying to prevent is a lot of that excessive use. So there still might be a real effect from raising taxes, separate from any prevention funding that's raised that way.
Well, you know, and that's an important point. You know, there is a segment of any of these taxes that has addiction, not all, of course, small. In some in the literature call them super users rather than use, you know, so as they would have to use so much per day or something. However, any description of the end elasticity as significantly elastic is wrong. There is no significant elastic that is below 1. In economics, and maybe that's a different discipline, but in economics, you have unit elastic, you have inelastic, and you have elastic. And I think I've spent about half of that time showing how this is so well known in economics. It is inelastic. It doesn't matter how you want to describe it. It is just inelastic. It's inelastic or alcohol. There's no two ways about it. It doesn't matter. Yes, would it get something? Okay, but that's still inelastic in our definitions, the way we understand the analysis and so on. So I'm sorry. I know that you're trying to put a face on something that is just not true.
I think it's just refine. I think it's, yeah, I'm not an economist and don't know the exact terminology that you're using, but if we're using the term perfectly inelastic for that vertical curve, then there is some elasticity just logically when you have it. But let me say it a different way. I would say that there is a significant effect on use, even for those inelastic.
Well, it depends what your significant. I mean, it becomes a definition. Significant is anything. Or significant.
Well, yeah, there is a reduction. There is a reduction in use for an increase in price.
Not significant, but some.
So, I have you for just a minute. Senator Solomon, please.
You're muted.
Thank you. Thank you. Thank you, Chair. I appreciate it. I want to say that just to piggyback a little bit on, thank you for the presentation, piggyback a little bit on Sarah Lochner's comment. Like, while I believe it's important that we could find dollars to provide a very strong prevention program, the issue for me is, like, we have the why it's important and what can be done. Where my issue lies is the how and the who. So how will this be done to effectively move the dial, and who is going to administer the funds? Because I wish I could say that I have confidence in all our state agencies. I don't. And my concern is that we would need to have real accountability, and that I don't necessarily see in today's dollars and today's programs that are happening. So I just wanted to share those comments. Thank you.
Thank you, Senator.
Has any consideration been given to what, feedback a little bit from a prior conversation about the elasticity? We've seen a lot of, changing of categories go down based on price changes, so that to say that it will reduce consumption is not necessarily true. We don't have a delta for that in the current situation. Has any study been done to see what would happen if beer and wine had a sales tax and liquor did not? Because I don't know, for me, I would think that someone who just drinks alcohol and is not as biased would certainly, over the course of 2, 4, 6, 8 years, start to change their habits towards drinking liquor if the perception of the consumer is that beer and wine is getting taxed and hard liquor is not. And I'm just putting this on a consumer part that is not thinking about the larger aspects of how taxes collect. So that's my.
Well,
I know that there hasn't been a study, but I'm just really curious.
well, that's, of course, that's, all studies, economists study everything.
The meaning of life.
That's right. There's always a study. Now, recall that in Oregon, if you want to translate the tax range from the still liquor, comes to almost 50%. So it's not one state, so the one state.
Of course, that's ignoring the state is the retailer and the distributor. The beer also gets marked up. It's 50% for beer for price to consumer based on what price. When I sell for $1, it's on the shelf for $2. For the same, I know it's not because of the tax, but because the state is the distributor and the retailer, they just get to keep that revenue versus us, we have to pay it to a distributor and the store.
Now, I understand, however, in the definition of a tax, and whether a tax comes out and funds something that is a government function, then that tax is funding the government function of whether it's all CC and doing this. So that is what a tax by definition. I know a lot of people sometimes use the word tax as taxing as heavy on us, that you're taxing me too much, rather than, it's actual taxation. And I'm sorry, I sometimes get into this public finance thing. Taxation means you extract money from one place and the government takes it and spends it as it pleases. Or, and it's
It's just praising you.
And preferably for ways and means, chairs, it would be all general fund.
Wait and see. Okay, it appears that time here is now in person or in visual at least, and hopefully your sound is better. Go for it.
Thank you. Are we hearing me better now? Yes, great. Thank you, Senator Solomon. That was a correct recap of what I was sharing earlier, but I have a different, something different that I'd like to share now in response to Senator Solomon's comment about where does the funding go? How does it go out if this is used for additional funding for treatment? Just for those who aren't aware of my role, I'm the Behavioral Health Director for Intercommunity Health Network, CCO, and Samaritan Health Plans. Also direct our Social Determinants and Transformation Department, which oversees all of our yearly community benefit investments. We have had quite a difficult time, like most of the CCOs in the state, in getting folks access to residential and detox services. That has led us to do a number of things, but recently we did a claims analysis over the last 3 years, and we looked at various sources of the data in our region, which we cover Linn-Benton and Lincoln counties. We looked at several state and national reports, and we had community listening sessions and other things like that. And Our takeaway was that while the severity and frequency of substance use disorder has been going up significantly over each of the last 3 years, utilization of detox and residential for our members has actually gone down. And the place that it has gone down for residential and detox is it's gone down for our penetration rate into out of area services. And what that means is because for detox, we don't have a detox in the region and we need to send people to Salem or Portland or Eugene, where we used to be able to get those folks in. There's so much demand now and the system is so overridden that the person standing on the street in Eugene, for which there are plenty, is going to get the Eugene bed, and we're not going to be able to get a bed for our person that needs to drive an hour and a half from the coast. Now, we do a very good job as a CCO in allocating funds and in doing things to build our behavioral health system. I'd be glad to talk about some of the ways that we do that. There was interest in that. But one of the ways that our funds are limited is in capital investments. When you're talking about building new facilities, new residential facilities, new detox facilities, you need to be able to make capital investments. That's where, you need $6 million or so to be able to start a detox center. Now, we're working around that, and we fully intend to get a detox center going. But if you look at, let's see, what was one of the reports that we looked at? In the public consulting group report, there was Region 3, which encompasses our region, Linn, Benton, and Lincoln County. There was an estimated shortage of 718 residential treatment beds, and an estimated shortage of 165 withdrawal management beds. And we are sort of uniquely situated as a CCO in our parent company, Samaritan Health Services, is the delivery system. So we are the hospital system as well for Linn, Benton, and Lincoln counties. That gives us access to quite a bit of data, and also just lived experience with folks in the system of how these different systems work and interact together. And one thing we all know is that it's not secret knowledge, is that outside of benzos, which are folks are addicted to at far lower rates, alcohol withdrawal is by far the most serious to withdraw from, the most deadly. In order to detox someone from alcohol, you need to have access to be able to get them into a hospital level of care if needed, because the risk of seizures and severe complications for withdrawal, it's 100 times more potentially fatal or risky to withdraw from alcohol than it is from heroin or cocaine or methamphetamine or any of those things. Those things are uncomfortable to withdraw from, but alcohol is deadly to withdraw from. And so what you have is a lot of folks who get far enough into their alcohol use that they want to change, but they can't do that outside of going to detox. We have a hospital induction program for folks on opiates where we can get them onto MAT. There are treatment paths for folks that don't involve having to go through detox. Alcohol is not one of those. So if you're gonna think about drawing a line to something, it would make sense that a tax on alcohol would help pay for the beds that it takes to get people safely off of alcohol when they want to quit, and also investing into prevention so that underage drinking is reduced, and in the future, hopefully the next generation produces less alcoholics. So I think going through Senator Solomon going through the CCOs would be, we are tied into the community needs. We know the SUD partners and providers. We're already working with them to problem solve this issue, but having some direct funds to put either into capital for residential and detox or to put into prevention initiatives would really go a long way. At the end of the day, most of us know, I know I certainly do, people of all walks of life who at different stages have become addicted to alcohol. It's devastating. The costs that go downstream, the cost to families, the cost to the legal system, it's significant. So that's just my 2 cents, but I do think there's an avenue for making smart investments into the system.
Thank you. Rob.
Thank you for that, Todd. I am of the opinion, and this is an uneducated opinion, or I have a perception. I have a perception that the treatment for people with alcohol and the treatment for people who are addicted to drugs are, well, I understand you just explained the medical difference between someone who's addicted to narcotics and someone who's addicted to alcohol. But once we get through the withdrawal process, the treatment, I would assume from someone who's been in treatment, that the process is effectively the same. So when you said that you did a study that explains that addiction has gone up significantly, my assumption is that the biggest part of that is because of the effects of the decriminalization of drugs. That addiction has gone up dramatically because of how we've now legalized marijuana and we've decriminalized narcotics. So if those two things are, so my question to you is that increase in addiction to addiction overall, I assume you don't separate alcohol from narcotics. And then my next question would be, how does the fact that the state has money to create treatment centers that haven't been built fast enough to address the addiction to narcotics, how does that play into the situation that you're facing, Todd?
So the residential treatment and below, I would agree that the approach is the same. I'm a person in recovery, LCSW, CADC3, master addictions counselor. But the getting to the point where you can do residential is where it all differs. Like I said, you need withdrawal management for alcohol. It is a cost on the system. It is a cost incurred by overuse of alcohol. As far as separating out by types of addiction, we didn't do that in this iteration. It's not that it's something that we couldn't do or that wouldn't be valuable. The last question that you had about, what is the state doing? Well, there are a lot of different factors there. I know that I was part of a group of the CCO behavioral health directors that recently, at the direction of the governor, put together a plan to put several $1 million with CCO contributions from each CCO out into treatment services. Part of that went into building a detox and residential campus with ADAPT down in Southern Oregon. It's going to make a big difference. And yeah, it's too little too late. But I think the question, there's so much going on in the social determinants of health. There's so much going on here. There's so much going on there. We would like to be able to help all of these things. And while the dollars can only go so far, there's an opportunity here to look at one specific problem and one specific avenue of supporting that problem. And if we could draw a direct line between taxing alcohol and then on the other side, paying for services that are going to help people overcome the negative health impacts of their overuse of alcohol, to me, that just makes sense. It may not make sense from a business perspective, but it makes sense for me. Well, frankly, as a human being, I mean, my thought is that if we could wipe out all underage drinking and all drinking of people who have substance use disorders, I would do it, just with a snap of the fingers. Now that would cut into the alcohol industry's bottom line pretty heavily. So I'm not sure if everybody in the alcohol industry would be on board. I like to hope so. But I think that's what I'm trying to approach is stopping underage drinking, helping people get treatment. This seems like, to me, a good way to do it. There are other things that the state could do, sure, but this is the one that I'm able to speak to.
Thank you, Danelle Romaine with the Oregon Beer and Wine Distributors. For sort of bringing us back to Maus's presentation. I appreciate thinking about this issue from sort of a different, looking at a different sort of tax that could potentially raise more significant revenue without sort of burdening it through the process. So while distributors are not supporting the sales tax, I do appreciate looking at the issue from a different point of view. I do think, just to Todd's most recent point, we don't give money to behavioral health providers based on whether they are proving that they're reducing behavioral health impacts in the state. So the idea that we, be taxing the industry in this way, I think we're not even holding behavioral health providers accountable today. We don't even know where the money's going. So I do sort of take offense to some of the comments that were made previously.
Aaron Sarnoff with Two Towns, a comment or question for Todd Jeter. I know you're talking about this from the CCO vantage point, which would be a Medicaid Oregon Health Plan patient vantage point. Anecdotally, I called around to numerous providers as a privately insured potential patient and did not have issues finding access to services. And I understand that there is quite a disparity between access for somebody who's privately insured versus somebody who's on Medicaid. Can you speak to that and help us understand, is there an actual issue for a privately insured citizen? Is there a true shortage of beds, or is it a issue with the type of insurance the patient might hold?
Yeah, I can speak to that. And under the health plan portfolio, which I direct, we also have a Medicare Advantage plan as well as commercial plans that I also oversee for behavioral health. So oversee both Medicaid and our commercial private insurance plan, as well as our employee plan. Before I speak to that piece, there was a comment just a moment ago about our behavioral health network not being managed. And what I would say to that is the level of management certainly varies by CCO. There are different practices around management. For our CCO in particular, we do quite a bit through our utilization management department to track the quality that our providers are providing, to make sure that folks who are going to best be served at the county are getting services there with things like assertive community treatment, the wraparound services and supports that they need, and that folks who are needing outpatient care and can get their meds managed by their doctor or getting them there. And in our private practices or in our nonprofits, we do look for overutilization. We are checking the quality of documentation. We're tracking where members are going when they leave. We're providing care coordination for them. So I think the idea that all of the behavioral health network is without management or oversight is false. As far as the difference in access for private insurance and Medicaid, what I'll say is that for individuals providing Medicaid services, those facilities are going through those residential facilities are going through a certificate of approval process, which is pretty extensive. They are also generally keeping folks for about 90 days of treatment. Now, treatment is individualized and it could be more or less, but the statistics show us that someone who has been in residential treatment for 90 days is twice as likely to stay in recovery long-term than someone who's been in treatment for 30 days. Now, managing commercial insurance, what I'll tell you is that usually the places that are offering commercial insurance are both regulated less They are also charging significantly higher fees, will not accept the rates of most of the time of the Oregon Health Plan, are seeing folks for usually 28 days is the maximum. So I believe that our Medicaid folks are getting access to a higher quality of care than they may be at some of these unregulated facilities. I would be hesitant to, as a steward of taxpayer dollars, to pay a significantly higher rate to a less regulated provider that we have less quality control over.
So to follow up, then would you say it is entirely possible though that somebody with private insurance has much better access to recovery treatment, whether regardless of what you feel the quality of that treatment might be, that there is better access for somebody who's privately insured?
I think you can't separate the question from quality because the triple aim of healthcare, right? Like we want to provide quality services. We don't want a revolving door at a high cost. We are stewards on the Medicaid side of public dollars to ensure that our folks are getting the best shot possible at long-term recovery. So I don't think I can speak to the question taking apart the quality piece.
Okay, so folks, I'm gonna take Senator Solomon and Salah now. Popped up, and I know we're gonna talk about that. Hopefully you can answer Aaron's question. I'm sure you wanted to hear. Then I want to cut us off here because I feel like we have to get to where we need. Got 40 minutes. Senator.
Chair, mine is just a really brief comment. In helping a young man that I've known since he was a baby to try to seek treatment, who had insurance here in Hillsborough area. The only treatment that we could locate for him was down in Eugene, away from family, away from job, away from all connections. So the idea that somehow we have an abundance just because people have insurance, I just want us to be really careful about that because I'm not certain that is a correct statement.
Thank you. Salar. You're on mute.
Yep, sorry about that. Solara Salazar. I just wanted to point out that there's actually zero difference in regulation between a facility that accepts Medicaid or private insurance. You go through the exact same process. Actually, the only difference is most private insurance require that you be, go through joint accreditation or CARF, which is basically a much higher standard of care. So if you were going to look at quality and oversight, private insurance agencies actually have much more, not less.
Thank you. So I also just want to just lay out there that behavioral health is a wide spectrum of things. It's a wide spectrum. And there is no such thing as one size fits all. There is no complete regulation on one thing or the other. And human beings respond differently all the time. So we may never get to that, who does better on what. Longer terms of treatment is actually really, really important to some folks who absolutely need it, right? That's just the way it is. Sometimes the shorter things support, it just depends on the human being. So we may never have the total answer to that. I just want to say that out loud. He's been working in the field for some time. I do want us to discuss sort of where we go from here, right? We don't have a whole lot of time today, so we may actually keep this 26th. I guess I want to put that out there right now. July 26th. I'm excited. I see some not excited faces. But I also just want to say we've heard a lot throughout this entire time. We've had a lot of conversations about where we go from here, or what may be good and what may not be good. But I want to be very, very clear that my whole point in having these conversations was to assure that we hear everyone's perspective and hopefully come to some middle ground somewhere. without intentionally or, well, without being damaging in one way or the other. We know that our system, we know whether we, always want to acknowledge it or not, our systems are not great, they're not perfect by any stretch of the imagination. And I will be real, we don't have enough resources. In the state of Oregon, I think I've said this many, many times, the state of Oregon does weird things with its money and we move things, I mean, we can't straighten out this big pile of spaghetti in terms of how those resources are moved and distributed. Maybe, who knows? That would really take some significant work, and I'm not sure that we have the ability to do that right now. And I want to appreciate the king here for showing up and being able to sort of lay out an issue of resources. And many of you have had some conversations with folks about kind of where I'm thinking now. But I want to know, I want to know what everyone else thinks as well. We talked about having concepts and thoughts about where we go from here in like 25th of July. If you have them, please get them in. I think they're going to be fewer than what Rosie thinks. I hope that they're going to be fewer than what Rosie thinks. But then I want us to be able to come up with just like be able to agree on a few concepts that we might go forward with if they are workable situations. Part of the reasons of talking about a point of sales tax is that it doesn't damage the industry as much. We haven't gotten to whether or not we're talking about a unit price or a percentage price or anything like that. I mean, obviously, but I want to know what people think about that. I want to know where we think that might go. What are the pros and cons of each of those options? Right, even again, we're having these conversations. I don't know how we want to go about like coming to a much more final decision about maybe those 2 or 3 concepts. Census, by vote, however people, want to get there. I see Chief Barrett. We have your hand up, sir. And you're on mute.
Yeah, trying to find that wonderful button. When are we gonna be able to, you want our written comments, but you also want to hear from us all individually? Can I ask when that's gonna happen?
Well, actually, so I want your written comments by the 25th. Concepts, ideas by the 25th of July, if that's at all possible. The thought here was that we would meet again on the 26th. If there was anything specific that people, again, to sort of hash this out, kind of. Yes, maybe that's probably not the right phrasing. To be able to look through some of the concepts and the ideas and see what people thought about them. I don't necessarily want to have individual conversations with people as much as just, I've had some individual conversations with folks telling them what I'm thinking right now. But I don't want to lay that all out. I mean, I could if y'all are interested at all, but these are just my thoughts about things. I want to know what everyone else thinks, and I want to know what we may have the ability to do with everyone on board.
Annalise Staub, Alcohol Drug Policy Commission. So once you have all these recommendations, is the idea that you're going to take them and kind of categorize them? Like, do you want them? I know there's a set of categories. Like, are you hoping that people will say, like, here's a recommendation for number 3, so that Rosie can then put it into.
Yes.
So I asked that because I'm just wondering if maybe we need a little bit more time than coming together next week to kind of see what that constantly looks like. I mean, I'll be very transparent. I can't imagine we're gonna get this to you that much before the 25th.
Guys, for the minute, you're giving me a hard time, but I totally understand that it's gonna take a little bit more time. I think for us, there's plenty of deadline as well, and putting all that information into one and then putting it into the report will take staff some time as well. So that's another reason why we're given the deadline. But also, I think the important thing is if you come back, it has to be consensus. And determining how you want to go over each of those questions amongst all of you. Do you want to rank them or have a vote on every single one of them and rank them based on the category of things? So
Yeah, I'm trying to figure out how to do this, and I will be honest, folks, I know, you know, this is a longer conversation, obviously, we'll need more time to sort of think about them. But the reason we sent the request out early, again, was laying out all of those different pieces. But to say, what do you think about these sort of things, and where could we go from here? And be, yeah, consensus or vote or whatever, it doesn't. That's
and I don't want to call him out, but Jason Renault sent an analyst a question, I'm gonna put it up there before the speech.
right.
And it was a very thoughtful response in that he provided some explanation of why he chose the position that he chose. So it was really good, and I was going to use it as an example that we did come up together.
I'm happy to not meet on the 26th if people feel like they need more time and to pull those things together. And then, of course, that Rosie, you need some time to sort of do some analysis and put things together in a way that makes sense. That would mean we've got a meeting scheduled for August.
We want something to say right on this meeting just to come back, so we can do something around that time. And to put up the agenda again. Because we started with a process in terms of just analyzing each meeting.
Which one?
That's kind of the same thing I was gonna say. Oh,
I'm sorry, go ahead.
I was gonna say, sorry about that. That's kind of the same thing I was gonna say. I'm gonna miss the 26th. I'm gonna be on Canoe Journey
Oh,
until the
okay.
2nd of August. And to process each one of these meetings takes time. And to figure out what exactly we're gonna do and what you actually want from us all is kind of what I'm asking. Because I know right now we need more dual diagnosis facilities and we need more treatment facilities. So we're having a problem with putting people in treatment from my part of the field. So I can get my comments to you, but are they gonna include the last 2 meetings?
Okay.
And Aaron, this today's agenda, so folks can see that we kind of planned out and did just a brief outline of what sport would look like, and this too would be something that we discuss with members of the task force to determine whether or not and what else we should include in the online point.
Well, maybe Rosie to know from your legislators, could you, after everyone submits their ideas, maybe categorize them by things that may have consensus? What I'm imagining will happen is there may be some consensus on programs, but not on the funding source, right? It's the logical from that's a short of it. So you might distinguish in that way. There's consensus that it would be nice to fund this, but there's disagreement on the source of funding and here are the ideas.
Yeah.
And then we do have a conversation about that because I'm guessing that's sort of what our consensus being like.
Well, yes, we agree, yes, but obviously, with the key pieces that we're outlining in short of any. So let me ask you this then, folks. Is August 15th an option? I can make myself come back.
Yeah, my only comment is I tried to work it out, but I'm be touring Popcorns tonight for that day, and I've been told that I'd be able to tune in on this virtually at that meeting. That's actually what I'm going to be doing today in Oregon at this meeting has happened. So it's been sort of on that not sure list, but I've made that arrangement. But if anything were to change, I would not be sure. I guess that's the easiest way to say it. So I'd be there's a small chance that I would miss that meeting because it will be in Idaho. But the date is okay. It's just saying out loud that I missed it.
Okay. What's yours? Does it work for other folks? Does it work for folks online? I see Senator Solomon, you have your hand up. Doug, thank you. Senator
Thank you,
Solomon.
Chair. Yeah, thank you, Chair. My quick question is as you're compiling this data that you're asking people, you know, the surveys of information, I think another missing aspect, and you can correct me if I'm wrong, if this is somewhere out there that I am not aware of, but if we could see the funding streams that are already current, because I think that's a missing element, is to be able to see what already and who is administrating those dollars. To be able to have that information as well, because I feel like we deal, or we talk about in Oregon how we want to break these silos, and yet we're now talking about a potential additional revenue stream that I want to know what else is out there, and so I think that would be helpful. I'm a non-voting member, but I'm a vocal member. Thank you.
Yes, you are. Thank you so much. Are you talking specifically for existing privileged tax for alcohol, for beer and wine?
No, thank you for the clarification, Chair. I'm talking about existing programs that already are being paid for through state dollars for residential treatment, for recovery, for prevention, including even like in the OIA budget line of behavioral residential beds, right? We have, you know, and then all the different types of funding, and where that I think we kind of need to see that as well.
Okay. Thank you. Thank you. So Laura.
Well, I was just gonna say for August 15th, we're taking our clients to the powwow in Grand Ronde. Does anybody know if there's cell service down there? Because then I can do it online.
On the 15th, it's a Thursday. It's powwowing on a Thursday.
It's Thursday, Friday, Saturday, Sunday.
Rude.
We get to camp. We're camping out, so we're doing the full deal.
I might actually have to be online for that one too, now that I look at the calendar better.
Is there another date in August?
With the morning.
About a week,
work?
what about a week later, the 22nd?
I can't do a week earlier. I could possibly do a week later.
This is Sarah Lochner. A week later, on August 22nd would work better for me.
You're right. Okay. Well, I know this is really difficult. Maybe we can send out a doodle poll that comes up with another date that's not necessarily a Thursday. Or we can, yeah, see if we can find a day. Our mornings or afternoons better for anybody in particular?
Yes, it's better to me, but I'm driving here.
Okay. Afternoons are better for the most part. Anybody online? Rob?
I'll let you finish the question. I actually am not on the topic of scheduling right now. I have something else to ask.
Okay, so let's just finish that one real quick. If I can ask Rosie to do a doodle poll out for anything, for August 15th. And before the one year already existing for first meeting that we have, because we want to give people time. Yeah.
There's just confirm the county, so are we going to give folks an additional fee so we can have a more structured looking, yeah.
I feel like you should get the recommendation as soon as possible. Thank you for putting that out there, but
Give us a
right.
deadline.
yeah,
feel
give
like-
us a deadline.
I feel like the deadline of July 25th for your concepts or ideas, I think is pretty solid, because this thing went out more than 3 weeks ago now at this point, right? Or right around 3 weeks ago. It's a good amount of time. So I would like to hold that deadline, but give Rosie and folks more of a chance to do that. And if possible, maybe we can, once we have an idea of where those buckets are, we can send that out to folks and give them an opportunity to look at that a little bit more decisively and figure out sort of where you're thinking, right? But then we can, again, do the doodle poll and find a date that actually works for people to come back. In person and online, of course. Somewhere. After August 15th.
And that will give us some time to work with the folks and reaching out to individuals on what that.
Right.
Being able to talk to them about.
Sure.
How to categorize.
You'll have a better idea.
Yeah, we'll have an agenda already after we're looking at, but it will take some time. And I know, I'm sure say Ramsey, but we do have Adam and Tyler. And I'm sure the director is going to get into a little bit as well, but we, we have a team of folks who are working on it to make sure that. So, thank you guys, I just want to make sure that I call you all out. And I'm sure we're going to incorporate Madison into it as well.
Yes.
Take a look at it. And we'll be meeting,
Right.
regularly.
This is again, part of the whatever your concepts are, whether or not they're in fact legal and doable is also a question. Right? That is also, that's always a thing. I'm always amazed by that sometimes people have great ideas and we're like, yeah, not illegal.
Especially when you're talking.
Right. Okay, I'm gonna get back to Rob. 1 second.
I'll schedule.
Yeah.
Yeah, thank you, Madam Chair. My question is, a lot of what I'm hearing throughout all of these meetings is just the lack of access to treatment. We just heard that the treatment systems are similar for addiction to alcohol and addiction to other narcotics and other forms of drugs. I'm also aware that the state has collected a large sum of money to build treatment resources into the system. And I'm curious to know if we could get, I'd heard that those resources were slow to getting out into the community. And so I'd like to know if there's information out there that reports back that we could get that would say how much the state has collected through marijuana tax that they intended to reinvest back into the treatment system statewide. How much is still out there and that hasn't been utilized?
So this is Annalise Self, the Alcohol and Drug Policy Commission. I just want to make sure I'm understanding and maybe a reminder to folks. So remember we had those presentations from OHA. I heard this from Senator Solomon, where's the money going? So we have that substance use disorder financial analysis that tells us across state agencies where different revenue streams are going. And it has, I believe, federal and state funding. It includes cannabis tax. I think, Rob, what you might be referring to is the general fund and the ARPA funding that was invested over the past couple biennia. No? Okay.
No, it was my understanding. So in the state of Oregon, the state of Oregon took back a portion of the marijuana tax that was distributed to cities. And the explanation, as I understood it at the time, was they were going to use those resources to invest in treatment facilities. I saw it as a connection to Measure 110 and we don't want addicts in jails. We want addicts in treatment centers. And so the rationale, as I recall, was to use that money to build treatment capacity in the system. And then I was reading reports that the money was slow getting out into communities.
I know.
It's the Measure 110 Behavioral Health Resource Network funding, which is included in that report. There's also a dashboard on the OHA website that I think should be in the maybe we can reconnect that. But that's the Behavioral Health Resource Network funding that has gone out to all counties.
But analysts, that's what was spent, not what was budgeted. So we know what they've spent. We don't know how much is still sitting there. That's what that's what's spent.
Okay, I'm honestly not clear about what resources we're talking about, but I do have something in the back of my brain that says it came back, or we thought it was coming back, but it actually didn't. It actually was able to stay in those programs and able to actually do what it was supposed to do. That was my memory. I could be completely wrong. We would have to ask the question. I think we need to ask the question. And if you could do me a favor, Robin, just shoot me an email about it so I can cue my brain to remember about it. And
Yeah,
ask the
and I
question.
can, I mean, I can find out. It was a take back from the state marijuana tax. I'll
Right.
talk to the League of Oregon Cities.
No, I do remember. I remember it very specifically, and I remember asking about it. And what I then was told, again, I could be wrong because, I talk about money all the time.
Was it House Bill 5? Was it House Bill 5204? Someone
I
sent
don't-
me
I
a
don't know.
PowerPoint that
Don't
has.
know.
I believe that's the funding mechanism for, isn't that for 4002? So we're talking even earlier.
Well, no. This is, it was 211.16 million, and it was investments in behavioral health capacity and services with shovel-ready projects, community restoration, access to Medicaid-assisted treatment, behavioral health workforce, and then prevention.
That sounds right to me.
Okay, that's right. That's 2024.
So that is a revenue stream that there were newspaper reports that identified that the resources were slow going out into the communities. And that's an ongoing revenue stream. I would just like a report on how that money's being utilized. And again, I can follow up with the League of Oregon Cities to get more detailed information, and I'll email you, Madam Chair.
Thank you, if you would please, because I don't recall that being a separate revenue stream. That's another question. Senator Solomon, or, sorry, Vaughn. One of you. Vaughn Berry.
Oh, I'm sorry. I had my hand raised to say what I just said about the
Oh,
bill.
okay.
I would say, I think it was one, I think what, and I sent it to, you, Chair Sanchez, just so you have it.
Okay.
I think it was ballot measure 110 money.
Yes. That doesn't mean it's on. Yeah. All right, Senator Solomon.
Thank you so much, Chair. Just to give an example of kind of the discussion that I think we're having here and my thought process today is several meetings ago, we had a presentation, and I apologize, I don't quite remember the detail, but it had something to do with dollars that were collected. And I do remember the amount was 55 million, I do believe, and it went to the OHA behavioral health and used for prevention and such. And when I asked the question during that meeting, I was like, what I would like to know is they received this money and, what is it spent on? And I think the answer I was given was less than satisfactory. It was like, well, we get that money statutorily. That's, that comes into and it has to be spent in that account. Well, fine and dandy, but what is it being spent on? And is it moving the dial? So I really honestly feel this is a bigger conversation on not just getting these resources, but getting them to the folks that are moving the dial, because I think nothing is more frustrating to us legislators and to constituents and Oregonians and people in the process of helping people that are true, like Todd said, but if it's not moving the dial. And so I guess that's the part of it too, is finding the funding stream and telling all of us, what is it being used for? And is it making a difference? Before we're adding more money to a pot, let's find out that the money.
So let me just say.
There we go. Sorry.
Thank you. What I want to be real clear about here is that has been made very, very clear that people have a frustration about where the money goes. Which is part of the reason why I said what I said earlier, which is behavioral health is very difficult to wrap your arms around, just because human beings are human beings and they do well and then they don't, and then it's hard. You can't, and addictions are hard. Addictions are hugely difficult to sort of wrap your head around and manage all of that and just assume that, I mean, I look at it also similarly to domestic violence. You know that we know now, studies would say you leave 7 times or somewhere around that time before you actually get out of an abusive situation. People in addictions, you know, fall several times sometimes before they can get out of addictions, right? And people relapse at 1 year, they relapse at 5 years, they relapse at 7 years. That's a known, right? Those are known numbers, right? It just happens. And so, and we just came out of a pandemic where we know that people, and not only a pandemic, but the influences of Measure 110. So it's really, really hard to sort of say how, you know, any resources that we had in the past got used and whether they did any good or not, because we're also dealing with a level of drugs right this very minute that people are really, really struggling with in terms of wanting to heal from, sadly. But what we also know is that 100% of the kids that did their little intakes in the recovery high schools that did their analysis, 100% of those kids started with alcohol and then marijuana. So I'm focusing on kids, focusing on young people, because I know that's a place where we actually don't have the resources. We don't have the infrastructure. We don't have the ability to do that work right now. What we have is very limited, and I know that over and over and over and over and over again, parents have asked me, what do I do? Help me find a place, and there isn't anything there. Or it's so very limited that they cannot find a place to get their kid into treatment. So I'm going to necessarily tell you all that was my focus area that I'm hoping that people will go to. And here's the reality. We don't have a system that works specifically for young people at this point in time. I don't know. Do we have a system, Annalise? We don't have a system. If we need to focus this money, pull some resources together to focus it in a place where we know we have a huge deficit. And 21 and under is where it needs to be. It's not, we don't have the analysis because it doesn't exist. Right? But we know that we have a deficit. We know we have that deficit. So, something to think about. That's Aaron.
And just the comment to Senator Solomon's, I think, again, from us on the private side, there's potentially hundreds of millions of dollars that are available potentially unspent or misallocated. We know, for an example, 7.4% of all dollars spent on SUV funding in the last budget cycle are unaccounted for. What happened to them? That's $72.5 million right there. I mean, looking at, our CCOs, they're supposed to spend 85% of their tax dollars that they receive for patient treatment. Less than half of them accomplish that. So there's perhaps another 5, 10, 15 million there. As we just kind of look through all these buckets, there seems like there's a possibility for a lot of resources that might give in. I think that's what the frustration is. I can't run my business like that. If I have missing money, I go to jail. You know what I mean? Like that doesn't work on my side of the equation, which is why we're really pushing on trying to figure out how do we take the money we have and make sure it's being done.
Thank you. I think one of the unfortunate things that we all are dealing with is the fact that the voters legalized or decriminalized narcotics again, because they don't want, because rightfully so, we don't want addicts sitting in a jail cell. We want addicts to be able to get help so that they don't live that lifestyle anymore. But what we did is we decriminalized it before we had the mechanism to be able to deal with the onslaught of people who are on our streets, homeless and addicted. And so if we're talking about addiction, which I think we keep coming back to that, then it's no wonder that we have the problem that we do when we went down the path that we did. And so, again, I think there's a pot of money out there that used to come to cities to deal with law enforcement issues locally that the state wanted to use to build capacity for treatment. I also think that because of the decriminalization of narcotics, there's a lot of people that aren't in the jails anymore. So where's the money that used to go to put these people in jail that could potentially be then redirected into the systems to help support the people that are struggling in our communities?
Okay. So, sorry, Inspector Street. No. So are we referring to the marijuana money? Was originally in Measure 91 formula that was 40% state school funds, 20% mental health, alcoholism and drug services, 15% state police, 20% cities and counties, and 5% Oregon Health Authority for drug treatment and prevention. That was the original design of marijuana funds before Measure 110. And now we're right here with supposedly, I don't know what that number is. It's more like, it's like drug treatment and recovery services and $90 million to cap, the $90 million cap for Measure 91 recipients. That's the money that we then ended up having to backfill some of the cities and counties and state police through the general fund, right? Because the majority of that, when Measure 110 passed, it moved all of that money to the drug treatment and recovery services, which couldn't get out the door. BE Manor, which still is working on things that are there and are doing better, and we're starting to see them now. But I'm assuming you're referring to that original design. That design no longer exists in the way that it did before. That's where we're at.
Yeah. Forgive me for my ignorance.
No, sir.
But,
I know it's
but the original plan was that when we legalized marijuana, the state shared in the state tax on marijuana. And then there was also local communities had the option to do a local tax. And then a year or two later, that share of the city's portion was taken back by the state. And as I recall, the explanation was we're going to build treatment capacity in the system to be able to manage these addicted, the addictions that we know that exist that are currently sitting in, they're in a jail cell. We're going to, and so that money is an ongoing tax that should be coming into the state to, unless it was redirected after it was initially taken. Specifically, as I understood it, to build capacity for addiction.
Yeah, I think Measure 110 stomped all over that. Measure 110 stomped all over my plans for the ADPC as well, by the way. Because you said that earlier that, we didn't, we were building on all of this stuff. That was very, very true. We worked really, really hard to start building on doing the analysis, finding where the gaps were, looking for county by county where things were missing in behavioral health systems. And Measure 110 came and stomped all over that work. And I will continue to be quiet now.
Yeah.
I get mad about it one more time.
There's oftentimes like over 200.
Yes. Yes. Okay. I'm sorry, Senator Solomon, please.
Thank you, Chair. And I think we should also, I feel like I'm just such a ray of sunshine today, but I feel like we should also make sure that we are acknowledging the fact that we were the lowest state in the nation for access to treatment. Then the decriminalization happened with no treatment plan in place. So boom, that's a recipe for disaster. And when I talk about the field, the stream, this, I want to make sure that current tax dollars that are being collected by alcohol and sales such like where those are going and how those are spent. The OIA behavioral residential beds, how are those treating for juveniles that are averting an OIA facility, but now getting treatment and such in communities? The marijuana money, absolutely. And I also want to question, I think 4002 had an aspect in there for youth prevention dollars for substance. So I want to see how much, obviously we don't have results from that, but we want to make sure that we're capturing that funding stream as well.
Can I just tell you
that's all I
that
have. Thank you.
That was not a funding stream.
Okay.
It was
an allocation.
It was one-time infrastructure.
Yeah.
Which went to help support and build those facilities.
Thank you.
So it was not ongoing resources at all.
Yeah, I thank you so much, Chair, for that clarification. But with the one time, what those dollars, where they're going, and what can they be used for, and who's doing that? It's just, I think that's an important to this conversation. I'm not going to talk anymore. Thank you.
Senator Solomon, just to piggyback on that, Denell Romaine with the beer and wine distributors. And while we're maybe one of the lowest in access, we're one of the highest, if not the highest in spending, which is why we keep going back to this cannot be just a money problem. It can't just be about new taxes. We've put so much money as a state into behavioral health, and it's such a large category over the past 5 years. That the idea that a new tax is a simple answer that will fix this seems really naive, considering what the state has gone through in terms of behavioral health appropriations over a very recent time and what other states are spending in this category.
So I will also say then that, yes, we did put so much money in behavioral health over the last 5 years because we just invested from the late 1990s on. And I remember very specifically before the Affordable Care Act came into place, sitting in a room in the city of Portland where people were on and on saying things like, well, as soon as the Affordable Care Act comes into place, we'll have all of these, behavioral health options and blah, blah, blah. And my fury, Darling Mayor and a few other folks, was that, no, we won't, because we do not have the infrastructure. We've disinvested in the infrastructure and we lost all of the capacity to be able to do that. That is the reality of the situation. We damaged our infrastructure around behavioral health, and having to build it back up at this point, that's where we're at. So that analysis of one of the lowest in the country was about the fact that we had disinvested in all of that. And we're having to build it back up slowly but surely, and it's been very, very hard and very, very long and very, very expensive, because anytime you shut something down, making it happen again costs money. It really does, and it's really sad and hard, and I'm frustrated by it, but it is the reality of the situation, and we are at a little after 3, so Laura.
I'll be so fast. First of all, thank you, Chair. You said that so perfectly. The only other thing I wanted to add on that is that I heard I can't remember if it was beer or wine industry, I believe wine talked about the additional farming costs and staffing costs in Oregon that are different than other states. We have those exact same higher costs in behavioral health. So you're talking about the mass amount of money that's different than other states. You have to look at, the amount of money that we have to pay our employees, the taxes that we pay, all of that we're paying in behavioral health is the same that you're talking about with your increased costs here.
There's not anything on this planet that costs less than it did 10 years ago. Yeah. So thank you so much, everyone. We will come back to you with more information about scheduling, and please get your concepts in as soon as possible. Again, folks, we are adjourned.